My name is Dr. Cozy. It's really nice to meet you. Really quickly to get started, can I just get you to verify for me your name and date of birth? Perfect. Okay. And so, you're here today for your first PAP. Yeah? Okay. How do you feel about that? Totally understandable. So, I do have rules in my exam rooms here, which is that you are absolutely not allowed to people please, okay? If at any point you feel uncomfortable, you want me to stop, let me know, and I will stop right away. We can either be finished completely, we can take a break, I can talk you through it, whatever it is you need. The number one concern in here today is that you feel comfortable, okay? Okay. You're in charge. I know that this can be a very vulnerable and sensitive experience, so it's really important here that we make sure that you feel comfortable, okay? So to get started, I am going to be asking you a series of questions. We will also be doing just a general full body exam. Okay, so your ears still, your eyes, mouth, chest, like your breathing, heart rate, all of that. Towards the end is when we will do the PAP. I will be collecting specimens to send out to PATH because it's really important that we rule out the presence of infection. We make sure that there's no sign of scar tissue, cysts that can develop, like on your ovaries. And also, it's very important that we check because there's a lot of risk for different kinds of cancers. Some of them can even develop from certain infections, which is why it's really important that we do this, okay? But we do this at your pace within your realm of comfort. So, my first question is just, do you have any questions or specific concerns about today? So you're experiencing a little bit of pain, okay? Which side? Or both? Okay. We will address that, okay? Later on in our exam. When was the date of your last menstrual period? Okay. And are you taking birth control of any kind? Or using an IUD, a ring? Okay. Are you currently sexually active? And are you using protection if so? Any history of irregular periods? Okay. Okay. And have you ever been pregnant? Any other current issues today? Any abdominal pain, nausea, vomiting? Recent illnesses? Any high or low blood pressure? Fainting? Headache? Okay. How about any frequent urination? Okay. Any history of asthma? And how about any joint pain, arthritis? Any neurological issues, seizures, confusion, fainting spells? And how is your mental state? Are you having any sensations of depression, any symptoms of anxiety, any... Okay, and then I'm just going to take a look here. So really quickly to start, I just want to check your temperature, okay? Open for me. Perfect, yeah, it just goes under your tongue like that. Okay, close. Okay. Perfect. Nice normal range at 98.4. I'm just going to take a look into your eyes here, just checking the vessels. Try to keep your eyes open. I know it can be a bit bright, a little irritating, but I need to make sure I don't see any sort of cloudiness or abnormalities within the eyes. Okay. Eyes look good. So then just looking without my light, just try and keep your eyes open. Okay. Can I get you to look up? Perfect. Okay. And then just close your eyes. I'm going to take a look into your eyelids. Okay. You can open. See my light right here? I just want you to, without moving your head, just follow it. Just using your eyes. Good. look inside of your ears, okay? So, just getting myself into position here. So you're gonna feel me pulling your ear back slightly. And I'm just looking to make sure that there's no sign of any kind of fluid or irritation, redness, or any sign of infection, perforation in the ear. It looks good. Just take a quick look at the external ear here. And we will check the other side now. So, again, you're gonna feel me pulling your ear back slightly so I can get a nice and clear view inside of your ears, your ear here. This side looks good too. I'm not seeing any sign of redness or erythema. No sign of perforation on the eardrum. Ear canal is nice and clean. I'm not seeing any kind of increased serum production or anything like that. So, again, I'm just going to take a look at the external ears here. Okay. I'm gonna take a look inside of your nostrils, okay? So, just gently here. Okay. Good. And I'm also going to take a peek inside of your mouth, okay? So if I can just, yep, perfect. And I'm just taking a look inside of your throat. Inside your mouth as well. So now I'm going to be feeling along your jaw and down your throat, okay? Going to be ruling out the presence of any kind of inflammation, angry lymph nodes, and also checking your thyroid. So, let me know if anything feels uncomfortable or painful at all. Can I get you to swallow for me? And again. One more time. Swallow. Good. And while I'm doing this, I'm just going to take a look at your skin here. Just making sure that there's no particular problem area that perhaps our resident dermatologist can help out with, but your skin's looking pretty clear here. Okay, good. And I'm not feeling anything that would be concerning. So now I'm going to be, excuse me, listening to your chest, okay? And then what I'm going to do is change your position on the table a little bit and have you lie down. Okay, still have a frog, hold on. Okay, sorry. I am very allergic to cats, and I do have a cat, and for some reason, sometimes, not always, she kind of triggers my allergies. Okay, so I am going to loosen your gown just a little bit, if that's okay. Thank you. So this is going to be just a little bit cold. See if I can. Okay. Can I get you to take a deep breath in for me? breath in and out. Okay. Breath sounds are nice and normal. And your heart rate is a nice 68 beats per minute. Looking good there. Okay, so now what I'm going to do for the rest of our exam is I am going to lie you back a bit on the table. You're not going to be lying down flat. You'll still be at a little bit of an angle, but this way I have a better ability to finish our exam, okay? Okay, so, okay, how are you feeling? Are you comfortable? Okay, so, first thing we're going to do here is I'm actually just going to feel your tummy, okay? So, I'm going to start. Any pain in any of these areas? Okay. And then, if it's alright with you, I would like to conduct a breast exam, okay? And that's also going to include under your arms. I need to make sure that I don't feel any kind of masses, lumps, any irritated lymph nodes, such as in the underarm area, okay? Are you okay with that? Okay. If you feel any kind of pain or discomfort, please let me know. So, is that okay? Okay. Do you do self-checks at home? Good. About how often would you say? Okay. Have you ever felt anything concerning? Okay. You can put your arm back down on that side. Sorry. Okay. Yes, just put your arm right over your head, just like so. Yeah, it can be a little bit ticklish, I'm sorry. Everything's nice and normal there. Not feeling anything concerning. Okay. So now we are going to move on to the pelvic, okay? So try not to fall over here. Like I said before, you are in charge here, okay? If anything feels uncomfortable, too much, let me know right away, all right? We will stop, or we can just take a break. You decide what is best for you, all right? Okay. So, then if you're okay, I'm going to begin. And the first thing I'm going to do is actually just take a look at the ligaments at the upper thigh. Your round ligaments, just making sure I don't feel any kind of lesion, adhesions, anything abnormal, all right? Okay. So, feel my hand. Is that okay? Any pain or tightness? Sometimes around your period? Okay, that's normal. These ligaments, they tend to get looser when your body is preparing for pregnancy, so they can cause a little bit of pain. That's normal. Okay. So now I am going to begin my external exam. You will feel my hand, all right? So we'll go slowly here. Are you ready? Okay. Just making sure I don't see any sign of external infection, any discoloration, lesions. Okay, that's good. So then, if you're ready, now it is time to start our internal exam. So I'm going to start with my fingers. I will have them inside, okay? We can start with one. If you're comfortable with two, we can move up to that, but I want you to let me know. And while I do that, I will be pressing around your uterus, your ovaries, making sure, or looking for any kind of scar tissue, the presence of cysts. You were saying that you were feeling something on your left ovary, you think? So I'll be especially palpating around your left side, looking for any kind of ovarian cyst or anything abnormal there, okay? Okay. This is when, if you do feel pain or discomfort, especially, I always want you to let me know, but I especially want you to let me know now, okay? Okay, so I'm going to be using, sorry, that was loud, and this is brand new, so I need to take off the protective foil. So I will be using just a little bit of lubricating jelly just to make sure that you feel as comfortable as possible. And okay, I'm gonna go slow. Are you ready? Okay, so you're gonna feel my fingers. All right, and is that okay? Any pain, discomfort? I want you to focus on taking some slow, deep breaths. Focus on your breathing. I'm going to be pressing down on your uterus. This okay? Okay. I'm actually going to start by feeling your right ovary. And let's compare it to your left. Right there. That's where you're feeling the pain. Okay. Sorry. Your uterus feels okay. I am feeling a little bit of an enlargement on the left ovary, so I will be writing you orders to get an ultrasound done, okay? That way we can rule out the presence of any cysts, and if there are any present, then we can come up with a plan for that, okay? It might be surgical, or it might just be a change in medication. Don't want you to fixate on that right now, alright? We're going to cross that bridge when we get to it. Let's just focus on one thing at a time. Sometimes these are difficult with gloves. Okay. Like I said, sometimes these are difficult with gloves. Where in the world? There we go. So I'm going to be collecting a few different specimens, okay? It's not going to be the most pleasant part. It's going to be, I'm not going to lie, it's going to be uncomfortable, okay? I'm going to get through this, though, as quickly as I can. And like I said, if you need me to stop at any point, I'll stop, alright? Okay. Do not just bear through this just to make me feel more comfortable. This is your body. You are in control here, alright? Okay. So, oops, I was just going to explain this and then I got off track. So this here is a little brush, and it's going to be sort of scratching your cervix so that I can get some cells collected in the bristles. We will have this sent off to PATH for them to run some tests, make sure that we don't see the presence of any kind of disease, bacteria, or cancers, alright? And then this is a bit of a large swab that I will be using to collect a specimen to run for any kind of sexually transmitted infections, any kind of candida, yeast, fungal infections, anything like that. I have one more here that we're going to use, and I'm going to leave this until it's time inside the wrapper for a virology collection. So this would be detecting for the presence of anything like HSV, okay? Okay. This is our speculum, okay? And let me actually make this a little bit. There we go. So, this is not the most comfortable thing. I am sorry. Like I said, I'm going to do this as quickly as I possibly can, alright? But we still need to be careful and thorough. So, I will put a little bit of jelly on the sky. Okay. And we will go slow, alright? You ready? Okay. So first, you're just gonna feel it, and it's a bit cold. Yeah, that is a bit cold. Okay. All right. So, you're gonna feel the brush to start. little bit of pressure here. Okay. Feel one more swab here, okay? So that pressure again. Going to very slowly remove my speculum, okay? All right. I'm gonna go ahead and give you some tissues here, okay, that you can use to clean up, and then we're gonna have you sit back up. Okay. How are you feeling? You doing okay? See, it's not that bad. I think that there's just a lot of emotionally psyching ourselves up. I hate going through this as well. You are not alone. I think all of us get some anxiety, but I'm also very proud of you because it's a really important step to take to make sure that your body is healthy and that if there are any issues that we can identify them and get them taken care of. So I know that it is very uncomfortable, nerve-wracking for sure, but you got through it and that's great. The first one is definitely the worst. So we will get these sent off to Path and to the lab. For the lab results, in terms of the bacterial and viral cultures, those will probably be back within 48 to maybe 72 hours. Pathology for any kind of checks for cancers or abnormalities along those lines do take a bit longer, so that can be up to 2 weeks. So if you don't hear a result from me or see one in your electronic chart right away, don't panic, okay? It's coming. Okay. Would you like me to call you as soon as I have each result or wait until I have all of them? of course. And let me see, the number I have here that ends in 2148, that one. Okay. Is it okay to leave a message? Not with results, just saying that I called in to call back. Okay. So then, because you are experiencing that left-sided pain, and I did feel something going on there, I'm going to be writing you an order to get an ultrasound. It will be transvaginal as well as through your tummy, okay? Because we got to make sure that we're able to get a clear picture of what's going on there. So if they have an availability, I definitely recommend getting this done today. The sooner you get results, the sooner we can come up with a treatment plan and help you feel more comfortable in your body, okay? It's important, especially because if it is in fact a cyst, cysts can cause something called torsion, which is when the ovaries twist, which is very painful. Can also rupture, and that could potentially lead to something called sepsis, which is when bacteria enters the bloodstream. It's very dangerous. So I don't want you to worry, but I do want you to understand that it is important that we get this taken care of, okay? We will not let it get to those points, promise. Which is why I'm also very glad that you came in today, and why it's very important that we get this ultrasound back. So then, I am also going to put in some orders for some lab work. So just checking your complete metabolic panel, which is electrolytes. I'm going to do a complete blood cell count. I'll do lipids for cholesterol. Just need to get a code. Have you eaten anything today? Okay, that's fine. Just need to mark whether or not the cholesterol testing is fasting or not. Okay. Okay, so after you complete the ultrasound, you are free to go, okay? You don't need to stay and wait for the results. Generally, I will have an interpretation from our radiologist by the end of today. It could be tomorrow morning, unlikely, but just in case you don't hear from me tonight, you will hear from me tomorrow. All right? Okay. As soon as I have those results, I will give you a call and we can discuss what to do next. Okay. Do you have any questions for me before I step out? Okay. Well, if you think of any while you're still here, feel free to tell the front desk. I can pop back out for a moment to talk to you, or just give me a call, or we can discuss your questions also when I call you with the ultrasound results. Right? Okay. It was really nice meeting you, and you did really well today. Like I said, I'm really proud of you. You got through it, and it wasn't that bad, was it? It was. Fair enough. But you did it, and that's pretty great. Okay. I'll talk to you very soon.